Broadcasting from the business capital of the world, this is the Podcast Business News Network.
And welcome back, everyone. A lot of us always going through something. If you want to be active, sometimes you pull a muscle here, you got discomfort there, or it just happens as you get older. Amazingly, acupuncture can help to make you feel better, especially when you have something like tennis elbow, or a lot of people playing pickleball now. You're experiencing maybe a little bit of pain. Acupuncture can support that. We're going to talk about those discomforts, how this whole thing works with acupuncture, and a lot more today. She practices out of New York City. Dr. Kelly joins us. She's our professional of the year. Welcome. How are you doing today?
I'm doing good, Steve. How are you doing?
Quite well, quite well. And even before we dig into any of this, we've said many times before, or you've said that in Chinese medicine, you can get a good indicator of what is going on with somebody in terms of their body internally just by looking at their tongue. And we figured we'd give this a real-time test. I text you pictures of my tongue, and I'm curious what you're seeing. So could you describe what it looks like and then what you think is going on?
Okay, so let me just
Hmm.
open the picture to see your tongue. So in general, you are okay, actually. Your health is fine. No big deal.
Yeah, I was actually a little concerned what you might say, but okay.
Okay. But there are a few kind of issues maybe we should pay attention to.
Okay.
Um, for example, I saw the tongue color is a little bit pale. So which means should kind of like have a little bit more red color, which means you may have a little bit of like blood deficiency, not too much.
Okay.
So
And
and
how would you describe that? Deficiency, blood deficiency. What could that be?
the blood deficiency it could be from food or could be from overworking, could be from stay up late, or could be from aging also. Like I kind of like mentioned about maybe I mentioned it before, like when we were born, like when you were a baby, everybody like full bloom, full of qi and blood.
Hmm.
So when you see a baby, they're just so lovely, right? They have no wrinkles, nothing. They're just almost perfect because they're full of qi and blood. But when we grow up past certain age, we kind of like going down road, right? We kind of like declining all our organ, kind of like on the decline side. Our liver, our gallbladder, our kidney, all kind of like not so strong anymore. Same as qi and blood. So our qi and blood also kind of like going to deficient, when we pass certain age. Or it could be from, eating cold food
Mm.
years and years. Then kind of like damage our spleen. Our spleen cannot really transform the nutrient we are taking in to qi and blood. So showing up on the tongue is kind of a little bit pale.
So you've said before, about this and about cold. By the way, have my warm coffee. Look forward to it, and it's on my radar about consuming cold beverages. I try to do it less and less and less. If you go out somewhere and they serve you a drink and it's cold, it is what it is. But at home, I don't hardly ever now since we started talking about this have beverages that are cold. But you're saying that years and years of doing that can present that way in a tongue. Can you reverse that? Can you reverse that by just drinking warm beverages or doing whatever?
We can reverse, but it's gonna take a time.
Mm.
So it's not gonna happen just in one day, even you say, okay, I have been drinking ice cold water, ice cold drink, eating cold food for a long time.
Yep.
Now I stop.
Gotcha.
Will my tongue getting better? It will get better, but it's gonna take time. And also, if you like want to do acupuncture, if you want to take some herbs, let me make it faster. You
Okay,
can
gotcha.
kind of like recover faster.
Got it. So you would say no matter what it is, whether and I'm intentional about sleeping better. I'm actually trying to slow down the pace of my life a little bit. So you're spot on there as well. Um, would you say that all of these things, it goes back, the things that you're describing goes back to the spleen?
Spleen is one of the organ kind of like mainly affected by the, not very healthy lifestyle, like food,
Yep.
like drinks. Yeah, of course, the other organ also got affected, but spleen is one of the major organ because, we need to eat every day. We need to take in nutrition. We need to transform that nutrition, and, we are active every day. So spleen is one of the major organ.
Okay. Got it. What else do you detect while we're here? Anything else you're seeing on the tongue?
So I saw a little bit indentation on the back of the tongue. So in Chinese medicine, we kind of like divided the tongue like three parts: upper jaw, middle jaw, lower jaw. Upper jaw basically like lung, heart. Excuse me. Middle jaw is like spleen, stomach. Lower jaw is like kidney and UB. So looks like on the lower jaw you have a little bit indentation. So I'm thinking maybe your kidney a little bit deficient.
Okay.
Like that's showing on the tongue because the indentation over there.
Got it. Got it. And I did notice, and this is only because I've talked with you that it's on my radar, but on the side of my tongue, a little serrated, if you will. It's a little, I don't know, I forget how you describe it, but it's got a little bit, maybe only on one side. Is that an issue? I bring it up because you brought it up in the past.
Yes, you have a little bit of teeth mark.
Thank you. I know how to describe that. Okay.
So from the picture, it's not too much. So in general, your spleen is kind of like okay, not too bad.
Okay.
Okay, so you don't need to worry about too much. I guess this is also because you start to drinking hot coffee,
Yep.
hot beverage for a while. So
Hmm.
make your spleen maybe a little bit healthier. Because the first time I see your tongue, I didn't see your tongue before, so I don't know. I cannot really compare. So if I have the picture, like you are not drinking hot coffee stuff, maybe the picture is different. Now it's showing your teeth mark is not that big, but you have a little bit slight teeth mark. So your spleen is a little bit weak. And also, I saw a little bit like kind of like the tongue have in the middle have a little bit crack. So the crack, what I usually explain to patients is like, for example, we haven't have a rain for a long time. The land kind of like a little bit dry. You have some crack on the, on the land. So showing our tongue, if we see some cracks, not major, so you don't need to worry about too much, just a little bit crack. So that means you may have a little bit, we call it yin deficiency. So Chinese
Mm.
medicine talk about yin and yang. So a little bit. So in general, I think your health is okay, but of course there's some improvement.
Got it. And based on what you've seen from others, if you were to put me on a 10 scale, 10 being, be honest, I'm asking, 10 being you look super healthy based on your tongue. Everything looks great. It's all looking good. That's a 10. One being, we've got some serious issues, apparently. Yeah. Where would I be? What do you think?
Um,
And
I
again,
think,
not scientific. We're just, kind of throwing it out
yeah,
there.
maybe between 6 and 7.
Okay. All right. And would you say that's kind of average?
Uh, I saw worse tongue for sure. So
I'm
your
sure you
tongue
did.
is your tongue is not worse for sure, 100%. So
Got it.
it's not
Okay.
too bad. It's
Okay.
not too bad. But we have some improvement over there. So
There's work to be done. Okay, got it. All right. Um, we're going to change gears now, and thank you for that. We've talked about that for a long time. I wanted um, our viewers, our listeners, to kind of get a feel for what you can deduce from looking at the tongue. And I say this all the time. I recall years ago when you went to a Western doctor, just a regular physician, they usually always looked at the tongue. They always usually take the pulse. That doesn't happen nowadays. And I never realized why they were doing that, the information they were getting. Why do you think, final question on this, why do you think that doctors don't all do that? Are they just not trained anymore to look at the tongue and pick up, certain things?
one thing is it's not easy to read the tongue, to read the pulse. It's hard.
Okay.
Even like for Chinese medicine doctors, for us, we were trained to read the tongue, to check the pulse, to tell your body's health. But even for us, it's very hard because although we started to be intern with patients, I think the second semester when we went to school,
Hmm.
but still, you have to really look a lot of people's tongue, check a lot of people's pulse. Then you may get a clear picture, like, oh, what this pulse linked to what a problem, or what this tongue body to
Right.
show the problem. It's very hard, even for us. To the Western doctor, I think they are more like focus on like reading like for example, blood work data,
Yes.
like look at the MRI, X-ray. They are more focused on the image or the test.
Yep.
But to us, Chinese medicine doctor, we cannot rely on any of the tests. All we rely on is the tongue, the pulse. So that's basically the only tool we can use. That's why we have to check the tongue, the pulse, because we don't have other tests to be rely on. And to be honest, sometimes the MRI, the X-ray, or the blood work, that data may be not accurate to reflect people's health.
Oh, yeah. Oh, yeah. I'll give you an example of that if I may. Um, it was February of this year. A few months ago, I had a squamous cell skin cancer appear on my neck. And I've been dealing with, skin cancer for years, but it's always basal, never squamous. So this was elevated and it grew in 10 weeks from just a scaly nothing to almost the size of a quarter. It was rapidly growing. Went to the doctor, scans, all of that. I was told by one doctor he was pretty sure it was stage 3. He was completely incorrect. I connected with a doctor who treated my mother for skin cancer. Somehow it just worked out that way. He was part of my health plan. It just happened. He changed after years. He changed into my plan. It was great. He looks at me and he's like, you're fine. It's not stage 3." I'm like, "Are you sure?" He goes, "Yeah." He just knew from looking. Um, and sure enough, that diagnosis was incorrect. So to your point, even with the scans, it's not always accurate. When you're looking at a tongue, I got to believe, based on your experience, you know what you're looking at. You have a pretty good baseline, pretty good idea of what's going on within somebody's body. So yeah, it's and this is the way they've done it for centuries. There was no scans, there was no labs, all of that way back in the beginning of Chinese medicine, right? Yeah,
Yes.
yeah.
I'm
It,
glad you're okay.
thank you. Yeah, it's all good. And there, that's 60 stitches. Can't even see it. They say
Oh,
I heal well. Yeah, can't even see it myself. So all good. So back to what we were talking about today, those injuries that we have, from activities, tennis elbow, pickleball, big now. A lot of people getting some injuries there. Acupuncture can help with that, right?
Oh, yes, yes. Actually, I have a lot of people come in for the pain. Like some people have pain, like start from the neck all the way down to the shoulder to the arm, even have a tingling finger. So I treat them, they feel better. And I have people come on in, say I have tennis elbow. I play tennis, but now my elbow hurts. I have to stop. Can you help me? So I treated this patient. I just got this new patient last week. I treated him just once. Then afterwards, I asked him, "How do you feel?" He said, "So much better." Yeah,
Hmm.
people may wonder, like, how acupuncture can help about the pain.
Right.
Yeah, for tennis elbow, basically when you play tennis all the time, you kind of like overuse the muscle or the sinew or the tendon. So you kind of like have we call it qi and blood stagnation over there. If the pain is really sharp, like somebody like stabbing on you, like that sharp pain, usually there are some blood stasis. We can also kind of like a metaphor is there's some scar tissue inside. So you cannot really see outside there's no scar, but inside there's some scar tissue. The fascia and the muscle, they kind of like stuck together, form the scar tissue. So
Mm.
the blood cannot move. That's why people experience the pain. So when I'm doing acupuncture over there, especially locally on the elbow, I basically break down the scar tissue over there. But when I'm breaking down the scar tissue, the patient may feel pain because the scar tissue over there, you have a needle to break it down. But afterward, they feel so much better. This is almost 100%. It happened to every patient. When I'm doing that, they feel the pain, but afterward, they feel great. But of course, if people like to come in multiple times, I can take time. To me, you know, I don't mind you coming in multiple times. So I treat you slowly. You can also getting better. It just take a longer time. I don't have to really working on the local elbow to make you feel better right away. I mean, you will feel better right away, even I don't intensely, manipulate the needle, breaking down scar tissue. You will still feel better. But when I really working on it, you will feel better sooner.
I wish I knew this a couple of years ago. I rarely play tennis, maybe like 3 times in a summer, just for fun. And I had a pain in not this elbow, this shoulder, and I'm pretty sure it's from tennis. Backhand. Um, I went to physical therapy once, didn't do anything. I wasn't feeling it's going to make a difference. I just let it go for about a year and it eventually got better. Had no idea you could go to an acupuncturist like yourself and get relief. Had no idea. This is amazing. Wow. Huh. What's a reasonable expectation? Everybody is different. Every call it injury is different. For somebody to start feeling some comfort in mobility pain. Is it right away? Typically, do they feel, wow, it feels a little bit better, but not perfect yet. It's going to take some time. But do people tell you they feel instant results?
Yeah, there are. So it's funny thing is Chinese medicine more like focus on like individually. So everybody is different
Yes.
and everybody's response is different. Some people felt relief right away. Some people felt relief maybe after 2 hours.
Hmm.
Some people felt relief maybe like next day in the morning. So everybody is different, but everybody feel better for sure. I have been helping so many patients. Everybody's pain felt better afterwards.
Are you actually putting the needle or needles in the area where there's discomfort, or is it other areas? Like, for example, let's say you have shoulder pain. Well, it's not necessarily uh, in the shoulder. It could be connected to an area in the back. Where are you actually accessing to make somebody feel better?
Actually, I use both. I
Okay.
use some local points. For example, if you say, "Oh, I have pain over here," I will have some needle over there. But I also have some needle somewhere else, like for example, to move the qi and blood. I maybe use the point on the leg. some people, like, I mean, if they have a little bit of anxiety, even they didn't say it, but when they come in, when I talk with them, I feel they have some stress. I may use the point on the foot. So to move the qi
Oh,
down, to kind of like move the energy from the top down to the foot. So their stress will be out. That can also release the pain. So basically both local and distal points.
very cool. I learn more and more from you about this every time we get together. Um, what do you want? Somebody's never seen this podcast before. They happen to stumble upon it. Maybe they're pondering acupuncture. What do you want them to know?
So I want them to know, first, acupuncture is not that painful as you imagine, because I have a lot of new patients. They never ever doing acupuncture before. They kind of like scared,
Hmm,
especially if they have like a neck pain, back pain, they have to face down. They cannot even see me, like how do I put the needle in, what kind of needle I'm using. They are a little bit scared. So, but I'm telling you, don't be scared, because first the needle I'm using is not that big. Okay, compare with the needle the Western medicine doctor use, it's tiny, tiny. Cannot really do anything hurt at all, to be honest.
sure.
So first, you don't need to worry about, you're gonna have some hurt or side effect. Two is, in general, acupuncture can help not only about the pain, but also your whole body's health. That's why a lot of patients reported to me said, Dr. Kelly, I felt my sleep was so much better, after treatment. I felt so relaxed. I usually wake up during the sleep, but that day I just totally slept the whole night. So that's one thing, you're gonna feel more relaxed.
Hmm.
And the third thing, your whole body health is gonna feel better. Like my the other patient came in for hyperthyroid. She said, her body looks like a more like have more tone, muscle tone. Like she even said her, because I sometimes needle her belly. She said her belly looks have more muscle, and her digestion getting better, her metabolism is getting better, and even her skin. She said her friends, they haven't seen her for a while. They said her skin looks better. So in general, acupuncture can make you healthier and look better.
Amazing. Uh, you're in New York City. So obviously somebody for acupuncture needs to see you there. But for a lot of the other stuff that we're talking about, you even saw some things, even with a text of a tongue picture, that maybe could be addressed with herbals and other Chinese medicine. Best way to find you, what's your website, Dr. Kelly?
It's Kelly 121 acupuncture.com.
Thank you very much for everything today and the insight. It's always interesting every time we get together, and I appreciate that. Looking forward next time.
Thank you, Steve.
Thank you. We'll be right back.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.